Today, we are releasing further details of the government's COVID-19 vaccine and treatment strategy, setting out how vaccines will be rolled out to the Australian people. By investing...
This was the target set by Prime Minister Scott Morrison in February this year.
Our aim is to offer all Australians the opportunity to be vaccinated by October of this year. Thank you very much for your attention.
Six months later, this is the reality across Australia.
A few days ago I said this was the scariest time that I felt since the pandemic started, and that's proven to be the case.
Clearly the situation in New South Wales has deteriorated and it is now of great concern.
The Northern Territory is now facing its biggest threat since the COVID crisis began.
So the risk is real and we need to act quickly, we need to go hard, we need to go fast.
Not since the early days of the pandemic last year has so much of the country been subject to restrictions.
That is why it's with a heavy heart that we lock Victoria down from 11:59 p.m. tonight until 11:59 p.m. next Tuesday night. This will be a hard lockdown.
From 6 p.m. tonight, South Australia moves into lockdown.
And our priority here continues to be on protecting the health and safety of Tasmanians.
I'm certainly sorry that we haven't been able to achieve the marks that we had hoped for at the beginning of this year.
The situation that exists now in New South Wales, namely around southwestern and now Western Sydney suburbs, is regarded as a national emergency.
Millions of Australians are in lockdown. The virus is spreading. And our vaccination rollout remains way behind schedule. It's little wonder many Australians are angry.
I think it's really poor. It needs to be much, much better. Many more people need to be vaccinated.
They've been very slow at the rollout. I think we had an awesome opportunity last year to get ahead of everyone else, and we've failed at it.
Completely shocking. They took way too long to do it, and they just didn't buy any vaccines in time.
Oh, it's sad. We need the economy to keep moving. We need people back working. It's terrible. It's terrible.
And we can't say Australia wasn't warned.
I think we'll have small outbreaks and they'll get bigger and eventually we'll lose control and it will spread. Once we get above a certain critical number, the virus will spread and we won't be able to contain it.
In May, we reported on the failings of Australia's vaccine rollout, which had left the nation perilously exposed to the threat of COVID-19. Experts warned that unless the rate of vaccination escalated quickly, the virus could spread out of control. And look what's happened. Tonight on Four Corners, we re-examine how Australia's vaccine rollout stumbled and the grave consequences for the nation. In the intensive care COVID ward of Sydney's St Vincent's Hospital, a patient struggles to breathe. Two nurses are caring for the middle-aged man in bed 4. He's being given oxygen and wiped down with damp cloths to try to bring down his temperature. The man is conscious and can utter only a few words, enough to give consent to being filmed to show his struggle against the new, most dangerous strain of this virus.
We should be very worried about Delta. Delta is many times more infectious than the original wild type of virus. It is really easy to transmit, and it is slightly more problematic when it comes to people who've only had one dose of vaccine.
And the other serious issue with Delta is that it infects children, which we haven't seen before outside household clusters.
18 months since COVID first arrived in Australia, the nation is no closer to containing it. There are currently 305 COVID patients in hospitals around the country, including 59 in intensive care. 925 people have died.
Well, we're facing a huge challenge. This is a crucial moment for us, trying to keep Delta at bay, keeping COVID at bay while we get vaccines rolled out. That is the number one task at the moment.
Yes, guys, we're ready for you. 1:45. Thank you. 1:45.
What time, madam? 2:15. 2:15. I don't think that yet has been called, but just wait over on that side.
2 o'clock.
2 o'clock's over there, sir.
At Sydney's Olympic Park, a mass vaccination hub set up by the New South Wales Health Department is operating flat out. With case numbers soaring in the city, people are turning out in droves to get vaccinated.
What time?
The staff here are administering more than 5,000 injections a day.
Have you finished? How did you go? Good job.
Guys, I'm ready for 1:45s now, please. Watch the footpath as you cross over.
After months of waiting, people here are relieved to finally be getting a vaccine, and most have nothing but praise for the healthcare workers.
Guys, just keep off the footpath until you're crossing.
I appreciate the staff working here. They're all very nice. Today is my second shot, so I have the first shot experience, and everybody has been very, very good.
But many are frustrated and angry at how long the vaccination program has taken.
It's annoying. Angry that everyone is now in lockdown across most states and major cities.
I think it's a lot of rubbish. Just get on with the job and do it. That's what I think, yeah. With the federal government, I just sort of think, oh, yeah, you should have just got in there and got the vaccine.
It's been disappointing. Yeah, it's been we've been let down. Yeah, there's no point in sugarcoating. It's just been a massive disappointment. Yeah, it's really sad. It just feels like we're walking around aimlessly, and this is never going to end. That's what it feels like, you know, and it's just real. The sadness is real.
I think we find ourselves in a pretty suboptimal situation. We're second last out of the OECD countries in terms of our vaccine rollout. And we're facing a situation, as viewers would know, where things are very dire for New South Wales, and other parts of Australia have recently been locked down as well.
Frustrations have been compounded by the fact that health experts have been sounding the alarm for months.
I think our vaccination strategy has been one of the worst in the world. What happened was we both delayed and we got it wrong. And so we are way behind in terms of the numbers and the proportion that should be vaccinated by now.
Australia's desperate need for a vaccine hit home during Melbourne's bleak winter outbreak last year. A second wave left 17,000 Australians infected and almost 800 dead.
If you go back in May, June of last year, we didn't know if there was going to be a vaccine or when there was going to be a vaccine. There were lots of groups who were in the race to develop a vaccine. Most other countries invested in a range of options. They hedged their bets across multiple vaccine candidates.
And we bet on a number of options, and sadly not all of those bets came through.
The government wanted a vaccine that could be made in Australia.
Domestic manufacture of vaccines is one of the most crucial determinants of vaccine availability, and most countries have found that. We're one of the few countries in the world that can make vaccines.
Why did we put so much faith in vaccines that could be made in Australia?
Well, supply has been an absolutely critical part of our national strategy from the outset. We foresaw what's occurred in Europe and North America without ever knowing what would be the specific outcome. We could see vaccine nationalism, international supply chain challenges, countries withholding vaccines. The need for domestic production was a fundamental component, not the only component, but a fundamental component.
Other countries were moving quickly to secure deals with a range of vaccine developers, including Pfizer.
Today, my administration reached a historic agreement with Pfizer to produce and deliver 100 million doses of their vaccine immediately following its approval.
Australia was slower off the mark. Pfizer told a Senate committee it approached the government in June to begin talks about vaccine supply. But a deal would not be made for 4 months, and then only for 10 million shots. We had a very small order initially for Pfizer, for 10 million doses. Why was it so small?
That was the medical advice.
Why would the medical advice be to have enough vaccinations for 5 million people? We needed a backup.
The world has never had, and this was something which Professor Murphy and the Scientific Advisory Committee were very clear on, the world has never had an mRNA vaccine previously. But as we saw clinical trial results and developed more confidence in two things, firstly, the safety, and secondly, the efficacy, then we were able to look at the production.
The vaccine backed by the government for local production was AstraZeneca, developed by researchers in the UK. It could be made onshore at the CSL plant in Melbourne.
Well, it was University of Oxford, so it came from a very good lineage. In addition, and most importantly, the actual cost was dramatically lower than the cost of all the other vaccines.
This is the cheapest vaccine. It can be administered, rolled out through just a simple cold chain. It doesn't need ultra-cold logistics. And it was really going to be the vaccine that was going to be the one for the majority of the world.
You're more used to wearing these than me. We're here today to announce that we've signed a letter of intent with AstraZeneca, which will enable to Australia to access, should it be successful, the vaccine for COVID-19 here in Australia, manufactured here in Australia, distributed free to 25 million Australians in the event that those trials prove successful.
By loading too many of your eggs in one basket, which is what the Morrison government did with AstraZeneca, they then effectively were betting, by and large, on a single horse. And as a result, they placed, I think, Australians at risk, and that is a large part of the reason we are in such a state of crisis today.
Not long after the Prime Minister finalised the deal with AstraZeneca, the company was in trouble after problems with its trial results.
You ready?
They announced a 70% efficacy rate. And in fact, that was not a valid announcement because it was two separate trials. So one trial showed a 62% efficacy, and another trial, which was a mistaken dosage, showed a 90% efficacy where they gave a half dose followed by a full dose. And they combined those two trials, and you can't do that.
Yeah, I don't think the company did themselves any favours in having variable information that sometimes needed to be updated after the request of regulators. I don't think we can say it fuelled the hesitancy we're now seeing, but it certainly wouldn't have helped.
In January, the government held another press conference to announce Australia's vaccine rollout strategy. The Prime Minister was keen to make clear the federal government would be in charge of distribution.
It's a federal vaccination policy, but with all vaccines, they are done in partnership with the states, and we've been following those processes. This is not the usual vaccination arrangement that we'd have, given its significance, and on this occasion the federal element of this vaccination policy has been driven very much by the Health Secretary.
I think they were hoping that the response rolled out well, and that would have put them in a good position politically to have an election.
Basically, the Commonwealth wanted to get the credit. The Commonwealth said, this is somewhere we can lead. We're going to pay for the vaccines, $4 billion, a lot of money. We're going to get every skerrick of publicity from that $4 billion.
How are you? Nice to meet you.
The rollout began on February 21, when the PM fronted up for the cameras to get his first dose of Pfizer.
Any questions or issues?
No, I'm ready to go.
Ready to go.
Just like the country.
Excellent.
Scott Morrison had set an ambitious target that every Australian adult who wanted it would be vaccinated by October.
This is about getting through the whole population. We said we'd get there by October, and we're on track.
The rollout was in trouble from the start. The first imported batch of AstraZeneca arrived at the end of February, but then the supply from Europe suddenly stopped.
I think there were 3.8 million doses of AstraZeneca which were due to come to Australia that didn't arrive, and I understand that probably put things back a fair way.
The flow of vaccines into the distribution networks just weren't happening, and so there were just everything that could possibly go wrong went wrong.
So in terms of communication, the government's been in a difficult position. They have not wanted to generate too much demand in the community when there are not sufficient supplies. But by the same token, a kind of silence or complacency from government about the question of demand and about the question of getting the community ready to be vaccinated, I think has been really problematic.
While the states administered most of the vaccines, the federal government controlled the flow and its supply was unreliable.
For whatever reason, the Commonwealth decided to send them direct to hospitals. And so we didn't know how many vaccines would be arriving each day. We had hospitals with people booked in, not knowing what vaccines would arrive that day. We had vaccines go astray. One of our hospitals received a batch of vaccines that were meant to go to a hospital in Tasmania.
Under the government's plan, GPs were given a major role in vaccinating the general public.
Initially, that was a real plus, 4,000 plus GPs, clinics, and so on. But I think that it's proven to be difficult because, one, you've got to distribute vaccine to these clinics. And it's GPs themselves have not been happy, right? They just feel that they invested a lot of time and, effort and capital in setting up their clinics for vaccination, only to then find that they were receiving 50 doses a week.
At Dr. Nathan Pinskier's clinic in Melbourne's Bentley, workers were overwhelmed by demand for the first round of vaccinations.
When the announcements were made by the government that the vaccine program in general practice was commencing, our phones ran hot. People looked up the national vaccination appointment system and they saw us. We, for some reason, came up top of the list in Bentley and we got flooded with phone calls. We think on some days we were getting several thousand calls a day.
But the delivery of the vaccines has been chaotic.
The challenge for us is that you order the vaccine and then you sit there and you wait and you wait and you wait and you think it'll probably come on Wednesday and it might come on Wednesday and it didn't come on Wednesday and you get to Thursday, has it rolled up, and then by Friday, should I be calling someone? And then if you do that, you're not sure it's still coming because you've got no tracking and tracing.
We're talking about one of the most complex logistical exercises, getting really restricted doses we had at that time, so just-in-time delivery to, close to 5,000 primary care points of contact. It's complex, and there will be issues. There'll be teething issues, and the booking system, people didn't heed our warning to wait until more GPs came online. They rushed the system, and those things often happen when you have a big program rollout. But the GP rollout has gone extremely well.
In March, the rollout was hit by news of a rare and potentially fatal side effect from AstraZeneca.
The biggest member states of the European Union have now joined the list of nations questioning the performance of the Oxford-AstraZeneca vaccine. Germany, France, Spain and Italy are all taking the precautionary measure of suspending use of the vaccine.
Despite the news, Australia remained committed to AstraZeneca.
All of the evidence that we have seen suggests that there is no increase above what you'd expect in that population, in the vaccinated population, of these thrombotic events. But clearly, there's anxiety when you've got new vaccines, and we understand that people want to be cautious. But we are very confident in Australia that those incidents that have been reported in Europe, and people have taken a highly precautionary approach, that they are not a significant issue. We've not seen any issue at all.
It wasn't clear at the beginning what exactly it was that we were looking at. So there had been these reports of thrombosis, but thrombosis isn't that uncommon. We hadn't had any cases in Australia, and we were looking to, Europe and the UK, where they'd, given 20 million doses, to say, well, are they seeing anything important? And therefore, if they start to put out warnings, that's when we would start to, to mirror that.
Then, on the 2nd of April, a 44-year-old Melbourne man was hospitalised with blood clots after receiving AstraZeneca.
It's a severe, devastating case for the patient. We were on alert because of the information that had come out from Europe. A small number of people have developed a very rare and very severe form of clotting in association with low platelets, which are the bits of the blood that help form clots.
On the 8th of April, Australia's advice changed, recommending AstraZeneca only for people over 50.
The health advice is that the AstraZeneca vaccine for persons aged over 50 is well advised, because their risk, should there be an outbreak of COVID-19, they would be very exposed to that risk.
On June 17, the advice changed again, recommending AstraZeneca only for those 60 and over. Since then, the advice has changed twice more.
I think there's been a lot of messages from different sources, which has been confusing. It should have been probably more directed, coming from a single source, would have been more reliable.
Confusing. Yeah, absolutely confusing and inconsistent as well. AstraZeneca's, from one age group to another, and then it changes. The information always changes, and it's scary.
I think there's definitely been a lot of miscommunication, especially about the AstraZeneca vaccine and, the risk of blood clotting compared to, people taking the pill is it's actually not that bad. So I think definitely could be a lot more communication on the risks of vaccine and a lot more kind of concrete medical advice on that.
Well, I do think people are confused. And of course, what ATAGI does is they provide this broad-based population-wide advice, and it's quite nuanced. And I think it's very difficult sometimes to take the nuance in that advice and communicate it in simple language for people. So yes, people have been confused.
More than 6 million doses of AstraZeneca have been given to Australians. 129 people have suffered rare blood disorders linked to the vaccine, 6 of whom have died. 925 Australians have died from COVID. Australians are now getting vaccinated at a rate of more than 160,000 a day.
Which jab are you getting?
I'm getting the Pfizer today.
Were you hesitant at all about the AstraZeneca?
Yes, I could have to say I was. So, yeah, I'm probably pleased that it's the Pfizer that I'm getting. Just after all the noise that's been made about it, I just feel a little bit more comfortable, I guess.
Despite the incredibly low risk of side effects, there is still widespread hesitancy about AstraZeneca.
I think there's a lot of fear. Friends of mine are I'm obviously in that age group where we're only now eligible, and a lot of people are hesitant to sort of get any form of vaccination, let alone AstraZeneca. But yeah, it's been, don't even get me started.
The biggest impact on hesitancy is, frankly, sensationalist media reporting.
I would have thought that the blood clots that AstraZeneca causes, very rare risk of blood clots, but nevertheless a real risk and people are frightened of it, that's the thing that's impacting hesitancy.
It is, but it depends how you report it. Of course it is a factor, but it sometimes has been reported, in a not particularly balanced way, and some people have reported it in a very balanced way. We want to be transparent, but we want people to understand that the risk of this blood clot is really tiny, and if you're a vulnerable person, the risk of severe COVID is high.
We haven't seen targeted campaigns for older Australians for whom AstraZeneca is safe and is the preferred and recommended vaccine because it's the one we can get right now. We could have done more. We could have had more targeted communications and persuasion to reassure those people that the vaccine is safe for them, and that might have saved us some of the pain that we're in now.
Australia's goal of vaccinating the nation by October has long since been abandoned. So far, 15.2% of Australians are fully vaccinated, a rate that is among the lowest in the developed world.
My name's Jared and we got Brittany on the computer. Alright, so are you on any blood thinners? No. No? Are you pregnant, breastfeeding or trying?
No.
No? So is this your first or second dose?
Second dose.
Second? How'd your first one go?
Okay, sore arm, but nothing drastic.
Perfect. Little sting.
In May, Four Corners visited the Gold Coast University Hospital, where infectious disease specialist Dr. John Gerard told us uncontrolled spread of the virus was inevitable.
I have no doubt that sometime in the next 12 months, this hospital will be used for the purpose for which it's designed. I think we'll have small outbreaks and they'll get bigger and eventually we'll lose control and it will spread. That's happened in the past. It happened, for example, in 2009 with the H1N1 pandemic. And at some point we will lose control. Once we get above a certain critical number, the virus will spread and we won't be able to contain it. But we are in this lucky position, this fortunate position at the moment that we have this lull, and this gives us an opportunity to vaccinate the vulnerable and to protect them for when the virus arrives. It's an extraordinary gift, and let's hope we don't waste it.
Federal authorities insisted Australians were well protected.
I think we're in a fine position. We've got one of the best public health responses in the world. We certainly have. We've proven this with now multiple small outbreaks, which we've managed to curtail and control.
Our guiding light, our lodestar, is the medical advice, and it's that medical advice which has informed the purchase of vaccines, and it's that same medical advice which has kept Australia safe as arguably one of the safest countries in the world.
In June, after another outbreak in Melbourne, the government ramped up its vaccination strategy, putting a military commander in charge and giving it a new name, Operation COVID Shield.
Some years ago, you might recall, there was an operation called Operation Sovereign Borders. I put in place at that time with the Prime Minister Abbott a completely new organisational structure for getting a whole of government effect on a very big problem. worked on that occasion, and I think moving to that footing now will further improve how we're working in the vaccination program. Lieutenant General Fruin will have direct operational control across numerous government departments for the direction of the national vaccination program. Thank you very much. Greg.
But we were unprepared for what was coming, a new and extremely contagious COVID variant, Delta.
I think the thing about the Delta variant is it finds any single chink in your armour. That's what we know about it. It is so infectious that any gap in procedures, any opportunity it has, it will escape.
On June 16, an unvaccinated limousine driver in Sydney tested positive to the Delta strain.
Sydney is once again on COVID alert. A man in his 60s from Bondi has tested positive to coronavirus.
Health officials said it was likely he'd contracted the virus while transporting the crew of a FedEx plane from Sydney Airport to their hotel. It was yet another example of the systemic failures of the hotel quarantine system.
We hadn't really improved the quarantine system for even the wild strain, let alone the variants of concern like Delta, which is twice as infectious as Alpha, and Alpha was more infectious than the Wuhan strain.
I was tested very early this morning and isolated and returned a negative test a couple of hours ago.
New South Wales resisted an immediate lockdown for Sydney and instead limited restrictions to the eastern suburbs of the city.
Since the pandemic has started, this is perhaps the scariest period that New South Wales is going through, and Dr Chan and I are of equal view of that. It is a very contagious variant, but at the same time, we are at this stage comfortable that the settings that are in place are the appropriate settings, but that's so long as everybody does the right thing.
We were too slow in locking everything down, and I know that the population hate lockdowns. They're horrible. But if you lock down early, particularly with Delta, you can get out early. And so you might not even feel the pain like we're feeling now. So we've not been prepared on multiple fronts.
Within days, it was clear the virus was spreading rapidly, and on June 26, a citywide lockdown began.
Good afternoon, everybody, and can I thank everybody for your patience. A few days ago, I said this was the scariest time that I felt since the pandemic started, and that's proven to be the case. So from 6 p.m. today, all of Greater Sydney, the Blue Mountains, the Central Coast and Wollongong will go into a lockdown with stay-at-home orders in place.
I think we could agree now that some much more unambiguous messaging about lockdown at the very beginning of this would have been highly desirable. I think we can also agree that a harder, faster and earlier lockdown would have made a difference.
Outbreaks were happening across the country.
Good morning. Thank you for coming in at short notice. The Northern Territory is now facing its biggest threat since the COVID crisis began.
So the risk is real and we need to act quickly, we need to go hard, we need to go fast. We just have to do this. So from 6 p.m. tonight until 6 p.m. on Friday, South East Queensland, Townsville City, Palm Island and Magnetic Island will go into lockdown.
Good morning, everyone. Last night we announced that as of midnight, Perth and Peel will be entering a 4-day lockdown.
By this time, Australia was awash with AstraZeneca. The concerns over blood clots meant people were cancelling their appointments to wait for Pfizer instead. Former Prime Minister Kevin Rudd decided to have a go at addressing the supply problems. On June 30, he called Pfizer's chief executive to ask for shipments of the vaccine to be brought forward.
I was simply appealing to him as an Australian citizen, as a former Prime Minister, to ask this: if additional supplies of Pfizer became available, could they consider bringing forward the delivery of Pfizer to Australia by several months, given that our needs in Australia were urgent?
What did you think of Kevin Rudd's intervention to try and speed up the delivery of vaccines?
Yes, well, it's good that former Prime Ministers would like to continue to help the country.
Kevin Rudd says he was astonished that Scott Morrison hadn't spoken directly to the Pfizer CEO.
The only analogy I can use is how we handled the global financial crisis. When a crisis is on and there are lives and businesses at stake in large numbers, there's no alternative but for the Prime Minister to become directly engaged. The smart thing to do is just to pick up the Alexander Graham Bell and have a yak and see what you could shake out of the tree. That's where he has failed.
In a statement, the government said, the Prime Minister and Minister Hunt wrote to the CEO of Pfizer in May and was successful in bringing forward 3 million doses from the fourth quarter of the year to the third. This has allowed us to receive an average of 1 million doses per week rather than the 600,000 which was due for this quarter.
Now, the ATAGI advice...
The government's response to the vaccine problem was to once again change its public messaging on who should take AstraZeneca.
The advice does not preclude persons under 60 from getting the AstraZeneca vaccine. And so if you wish to get the AstraZeneca vaccine, then we would encourage you to, A, go and have that discussion with your GP.
We've seen up to 49...
The appeal horrified Queensland's Chief Health Officer.
I don't want an 18-year-old in Queensland dying from a clotting illness who, if they got COVID, probably wouldn't die. We've had very few deaths due to COVID-19 in Australia in people under the age of 50. And wouldn't it be terrible that our first 18-year-old in Queensland who dies related to this pandemic died because of the vaccine?
I thought Dr. Young's response was very reasonable and scientifically driven. And I think that any evidence-based medicine or epidemiologist would concur that she quite rightly wanted her younger constituents that she is responsible for to have the best vaccine that would not only keep them safe from adverse events, but keep them safe from acquiring COVID and then reduce that likelihood of symptoms and therefore spread. So it's a win-win giving the young ones Pfizer.
After more than a year of publicly deferring to the experts, the PM changed his tune. During a radio interview, he lashed out at the experts from the Australian Technical Advisory Group on immunisation.
ATAGI has been very cautious, and that had a massive impact on the rollout of the vaccine program. It really did. It slowed it considerably and it put us behind. And we wish that wasn't the result, but it was.
Well, I think the Prime Minister's frustration is understandable. We want to see as many people vaccinated as we can humanly manage.
I think the Prime Minister's response to ATAGI was misguided. I think it represents a lack of understanding or consideration around what the brief of ATAGI is, about what their job is, and what is the job of executive government.
Dr. Katie Atwell is an expert on vaccine policy and an advisor to ATAGI.
I think perhaps there has been too much reliance on ATAGI to design policy for a successful rollout when that's not their job. Their job is to assess the safety and efficacy of vaccines and to consider the available supply. And that's why I think it's really important that we understand that ATAGI's remit is narrow and far more narrow than having responsibility for rollout. So I think the responsibility for rollout does rest with our executive government. It does rest with the Prime Minister and his team to be accountable for the decisions that they make.
Thanks for joining us, and apologies for the lateness of the hour.
By mid-July, the outbreak was spreading interstate after a team of removalists carried the virus to Melbourne. The city was plunged into its fifth lockdown.
It's with a heavy heart, but with an absolute necessity and a determination to beat this Delta strain, just as we did a few weeks ago, that the Chief Health Officer and the Public Health team have recommended to me and my Cabinet colleagues that we lock Victoria down from 11:59 p.m. tonight.
As Sydney's COVID numbers continued to escalate, the city's lockdown hardened on July 17.
the next decision was a difficult one, a very difficult one. But until July 30, until midnight on July 30, there will be a pause on all construction, large or small. Non-urgent repairs, any form of building, renovation, construction, maintenance, including cleaners into the home or workers into the home, will not be allowed for all of Greater Sydney.
South Australia was the next state to go into lockdown.
COVID-19 update. We know that this is moving quickly. We have no alternative but to impose some fairly heavy immediate restrictions to take effect from 6 p.m. tonight. South Australia moves into lockdown.
Delta had now spread to 5 states and the Northern Territory. More than 14 million people on stay-at-home orders across the country. Businesses were paying the price for Australia's low vaccination rate.
So we're looking about $1 billion alone of retail trade at risk in New South Wales, another $1 billion in Victoria. So if you add up the amount of weeks that both New South Wales, Victoria and South Australia have been in lockdown, you're looking at about $8 billion worth of retail trade at risk.
Yeah, so all of our casual staff...
Around Australia, restaurant owners like Jared Lanuza had to decide whether to close or survive on a trickle of takeaway orders.
It's quite sad coming in. You usually can't find parking. It's pretty hard. Even for your Uber to stop to drop you off is a bit of a hassle. But it's, I hate to say it, but it's a ghost town.
Trade is down 80% and casuals have been laid off. But the owners are staying open as long as they can, even handing out free food to hospitality workers.
Hey man, how you going? So we after, we have some spaghetti bolognese, casarecci with carbonara pesto, or beef and pork lasagna.
I think the main thing that we get out of it is something to do every day. Gives us a purpose. We come out, we're able to help people out. And yeah, it's nice to, even though we try and limit contact as much as possible, it's nice to be able to see people and, help them out.
The federal government has offered up to $750 a week to people who have lost work. But many businesses like this won't survive an extended lockdown.
No, I think we've looked at it a few times. We're going to try and stretch it out as far as possible. But the reality is that if it does go on for a few more months, it's probably us done and dusted.
There is a high level of anxiety, bordering on depression for many people, but a real frustration from the business community around the lack of vaccination rollout right now. And we know that vaccinations are our only way of getting out of these lockdowns.
Good morning, everybody. It was fairly obvious the way the numbers were going in the last few days that it would have not been possible for us to come out of lockdown. For that reason, I will be announcing now that New South Wales will be, or Greater Sydney, will be in lockdown for a further 4 weeks till the 28th of August.
For millions of Australians, normal life is on hold. Residents of this Melbourne inner-city apartment block are among many feeling the pain. They can't leave home for 2 weeks after an outbreak in the building.
I think everyone's feeling the same as fatigue. We're working from home, so there's no differentiation. Work, home, sleep, shower, cook, everything, it's all here. Look, we're getting through it.
From the vantage point of his 5th lockdown, Gavin Jeffs has had time to ponder what's gone wrong.
Just the hesitancy and the message. The message wasn't clear. I think the wrong messages that were delivered. We should be looking at the benefits of the vaccine and what we can do. So that's where I think we're held back. I'm sick of the politicking. Work together, we see snippets of it now and then where there is a little bit of collaboration, and then they revert back to, the finger pointing, the name calling or the blaming. Just let's work together and get through this.